Hello, everyone. Thank you for tuning in today. I hope you all can hear me. Anybody can just put a yes in the chat. Okay. So, as part of our initiative to help build strong foundation, we started the NEET PG Prep series in April with an aim to provide important insight on exam preparation by subject matter experts from Elsevier. So far, we have covered 5 subject areas, and the recording of those is available on our channel. Please take time to view those. In our today's session, we will be covering important topics for ENT, for NEET PG exam. And we will be discussing about common disorders, their clinical features and management from the exam perspective. For that today, we have with us Dr. Shruti Dhingra, who is the author of The Diseases of Ear, Nose and Throat and Head and Neck Surgery, the book that is published by Elsevier, which has been regarded as the most sought after text for the study of ENT. An erstwhile faculty member and a student of Maulana Azad Medical College, she was awarded a fellowship in laryngology and voice disorders at Mumbai and later underwent advanced training in laryngology at Massachusetts Eye and Ear Infirmary at Harvard Medical School, Boston. It is good to have you today with us, ma'am. If we could start this session by giving us an overview into common ENT condition and what are the must-know topics from the NEET PG perspective.
Thank you. I'm very grateful for Elsevier for having me here today. It's always nice to connect with students and to be one-on-one with, their journey through this NEET PG. What I would like to start with is the fact that your exam is approaching and I would want everyone to stay calm. I know this is a very stressful last month. But if you just stay calm and stay positive, I think it'll help you through the exam. As far as ENT is concerned, since it's a small subject, so don't have to worry too much about it. You're not going to get too many questions from ENT per se. Having said that, there are a lot of in ENT will be common and overlapping with general surgery. And because general surgery will include a large chunk of your question paper, so if you know these topics well, whether it's from ENT or general surgery, they will help you get free points. And if you read them from the textbook of ENT, it's free points. You are not only covering the subject, but also you will have a very good grasp on the topic. So there are some things that I would highlight that are for sure short to appear in the exam. Given many exams in my life, so many years of my training and work, I have been involved in setting question papers. So let me just take that definitely. Yes. I'm getting a lot of background noises. I don't know. Now it's better. Okay. So one of the first topics which most students tend to ignore and is extremely important is esophagus. Now, esophagus is something that can be tested not only because of its anatomy, you have to know the curvatures, you have to know its motility disorders like achalasia cardia and nutcracker esophagus and all of that. Then carcinoma esophagus is something which is tested commonly. Now, Eosinophilic esophagitis is one of the newer topics that is appearing in the exam, and I would really want you to go over eosinophilic esophagitis when the history will be of a child who has hay fever, asthma, and has history of dysphagia, and you'd have to take a biopsy and see how many eosinophils you see. So that's one of the important upcoming exam tested topics. Then Zenker's diverticulum is another favorite one. Hiatus hernia, Nissen's fundoplication, bariatric surgery. Now, I have seen lately a lot of questions on bariatric surgery, which are a part of general surgery, but how the esophagus is connected to the intestine, this can lead to the next question of dumping syndrome and things like that, right? Then red flags, upper GI endoscopy, and what are the indications? Now they'll give you a question where they will describe an elderly smoker has a dysphagia, or they will describe you a patient who's younger has dysphagia. So they will say which of the following is the best initial diagnosis, whether it is doing an endoscopy or doing a barium swallow or doing a FEES or doing a VFSS, which is video fluoroscopic evaluation swallowing. So I think you have to know some of these things. Esophageal perforation, another important topic. They will give you a history of somebody who has undergone a procedure and now has chest pain, and you can hear air under the on when you there's crepitus when you touch the skin. There's referred pain to the back, all of that. And vascular ring. This is a congenital condition where there will be an abnormal aortic arch, which will or a branch of the subclavian, which is going to go around the esophagus, leading to what is called dysphagia lusoria, which is going to cause some kind of a swallowing issue in a young child, maybe 1 or 2 years. So I think esophagus is such an important topic, and there are so many potential questions. One of the favorites for examiners, right? And motor neuron diseases also involving the esophagus. Esophageal manometry is coming up in many questions. So I think you just go over all of that. The next important topic to cover is thyroid. Now, thyroid nodule is a must know. For all the exams that I have given in my life, there has been a question on thyroid, whether it is testing papillary follicular differences, pathology, orphan antibodies and all of that, or it is testing somebody underwent a thyroidectomy and got a recurrent laryngeal nerve paralysis, something like that, or a superior laryngeal nerve paralysis, you can get a question. You will get a question on when you have to do an FNAC versus when you have to do an ultrasound of the thyroid. So all of that you have to know. Thyroid is a must know area. It is covered both. So, these things which are common both in general surgery, general medicine, ENT are likely to be tested more because they amalgamate so many things and so many questions. Facial nerve paralysis is another important topic. So in not only you have to know bells, but if somebody presents with facial nerve paralysis with say bilateral facial nerve paralysis, you have to know Lyme's disease. If it's facial paralysis with hearing loss, you have to think of acoustic neuroma. Facial paralysis with lower limb weakness, then you think of GBS or other causes. So not only knowing facial and what segment of facial is involved, as in if the stapedius muscle reflex is gone, what is the level? If the chorda tympani is gone, what is the level? So not only knowing the different levels in the root of facial nerve, but also facial nerve plus something else like hearing loss or bilateral facial or lower limb paralysis. What can that be? So I think that's an important topic. Then hypocalcemia. Now hypocalcemia you would think is a topic of medicine. They can put it totally as parathyroid surgery topic, and somebody came with a neck swelling, you did a parathyroid surgery, patient developed hypocalcemia. So hypocalcemia is something that is tested not only as an ECG finding, QT intervals, not only as management of hypocalcemia, Schoff-Stick sign regularly tested. Then patient had hypocalcemia, you gave him calcium, he's not responding. So what do you do now? So you have to give him test for magnesium levels and give him magnesium. So things like that. And Men's syndrome. Now Men's syndrome is such a common topic between general surgery and ENT, which will be likely to be tested very easily, picked up for exams. Trigeminal neuralgia, now that's another important topic, association with multiple sclerosis and which branch of the facial is involved. And then ototoxic drugs. You have to know the ototoxic drugs, all of them. Just read them through. What are they going to cause? Renal impairment and whatnot. So they'll give you a question about a patient who has underwent chemotherapy, is on platinum-based chemotherapy, now has sensorineural hearing loss, and you have to pick up what is the cause, whether it's age, whether it's chemotherapy, things like that. So I just want to suggest that keep your calm, focus on the overlapping topics which are easily tested. Then there are some specific ENT things that you have to know and which will not be covered in any other subject, like audiogram. They will give you something, they will show you an audiogram. You have to see whether this is conductive or sensory neural. Then according to that, you have to find out what is the cause, whether it's otosclerosis, noise induced, and whether it is otitis media. Cholesteatoma, very important topic for your I would say college exams, not very highly tested on MCQs. You may get one or two questions, but cholestoma is something you'll figure out. You can get a photograph of a cholestoma, so you should know how it looks like. And you might get a question on complications. So you have 10 complications and you can get a question on complications. You can get a question on what is the next best step if somebody has an unsafe CSOM and now presenting with headache and facial paralysis. So what is the next best step, whether it's MRI, CT, X-ray, all that. Okay. Next is, I would say, cleft lip and palate. Very important because it overlaps with embryology. And cleft lip and palate is the domain both of ENT and pediatrics and surgery. So you have to know all the embryology of the face, how the plates connect, and whether it's going to be a defect in the lip or palate, and both, all of that. Then you have to know branchial pharyngeal pouches and their derivatives. Again, thyroid, parathyroid. I just recently saw a question in an exam which said that a young child has presented for surgery, and there is an increased uptake in the lower part of the neck. So that was suggesting a ectopic parathyroid gland. And where do you think it has arisen? Which arch has it arisen from? Which branchial pouch has it arisen from? So you have to know the derivatives of each of those. Now, questions are not going to be direct now. The trend these days is to give more clinical based questions. So they'll describe a whole story of this patient who presented like this and that. And, you have to finally divide. First, you have to get to the answer, the correct answer. And then you have to know the diagnosis and next steps. Another important topic is spaces, neck spaces. So retropharyngeal space, prevertebral space. I have seen many questions coming on that, so that's important. And yeah, images. Images is something I want to stress on. You can get a photograph of an axial CT, coronal CT, or an X-ray. Especially, mostly they will give a paranasal sinus. You have to know. Now, I remember giving one of the exams, and the question was, they had not marked the right and left side. It was up to the student to decide which is the right side and which is the left side. Now, as an ENT surgeon, it's easy for me, but I think for the students who are just appearing in the exam, if you're given a coronal CT, you have to know which is the right and which is the left side if it's not marked. And try to look up images of the fungi like Candida, hyphae, aspergillus, mucor, how they look like. You can get a photograph of that describing the clinical story of a patient who had diabetes and who was immunocompromised, now had this black necrotic scar of the nose and palate. They'll give you a photo and then they'll ask you what is the likely organism, or they can ask you something about amphotericin B and stuff like that. Then another important thing, X-ray of epiglottitis, acute laryngotracheal bronchitis, steeple sign, all of these are important. I think we've covered a lot. Is there any other questions?
There are a lot of topics. I think because of all these topics, I think one of the question has come up is how do we prioritize all of this while preparing?
Yeah, great question. So, like I told you, you have to do the last 10-year questions, which I think everyone is doing. You will get it, you will understand and know the trend of the kind of questions that are asked. So, every time when somebody is preparing a question paper, they will try to ask you, they test the most common conditions. Rarely will they test you on something which is very uncommon or rare. So know everything about the common topic, the common conditions which you see, and one of few of the things which are rare, like the topics that I have just talked about. These are, I think, this is the gist of what your question paper is going to be. As far also anatomy, I think they are now testing a lot of questions about the blood supply, nerve supply of the external auditory canal, the ear, the pinna. Um, I think, I recently saw a question which described gout, and they said the patient has pain in the joints, which increases when he takes beer or alcoholic drinks. And what they gave in the question was a photograph of tophi of the pinna. So the question was of an ear, which was showing chalky white deposits on the pinna. So that was a question suggesting gout. Now you can decipher it from the history and examination, but you have to know how tophi of the pinna look like, right? So yeah, I think you have to. The most important thing is to read through the book thoroughly, cover to cover. You should know it, like you know where what is given in which chapter, and while you're preparing for the examination, now this might take 6 months or a year in advance when you are in your fourth or third prof, when you're actually studying ENT. That time you can do the questions simultaneously and just mark in the book what you think is it has appeared as a question. And then when you are revising, it just goes very fast because you've seen the kind of questions that are appearing. Another good thing I think that we've added in the book is the nuggets which are given in the end. So just before 2 or 3 days before your exam, if you can just read through all the nuggets, a lot of the important topics and syndromes, which are the favorites of examiners, will be right at the top of your brain and very fresh in your mind. I think that will help you to get free points on the exam. Yeah.
Yeah. Second question, ma'am, is about how how do you keep calm when when you have so much to do in so little time during the exam paper? What is the strategy and how do you approach the question paper in that case?
Okay, great question. So, how do you keep calm? So it's very normal to feel scared, anxious. There is so much at stake. I totally understand. But also, please remember that this is just an exam. It's not the end of your life, okay? And being stressed won't help you. If you are taking so much of stress, you can't sleep at night, you're not, your palpitations have increased. It's important to understand that this will not help you in the exam. For exam to go well, you have to keep calm, take a deep breath, and have the faith that you have studied well and everything will go well. I just do positive talking to yourself and tell yourself that you have worked hard and everything will go well. Another strategy I would say is that nowadays you're getting very long questions and story based, right? You get only 45 seconds to 1 minute to answer a question. So the best strategy is to read the first line, read the last line. So when you read, a 43-year-old man presented with difficulty in swallowing, so this is a question something related to esophagus and swallowing disorder. Read the last line. What are they asking you? What is the next best diagnostic step? So they're asking you an investigation. Now you already know that this is a middle-aged man who has dysphagia, and they're asking you some next best step. Now go to the choices. See the choices. What are the choices? Are they? Is it radiology? Is it an endoscopy? Is it this that? Now once you have read the first line, last line, and the choices, you already have an idea of what the question is going to be. Look for specific hints in the question. Now go back to the question and read it quickly and look for the specific pointers that are sending you towards the correct answer and guiding you towards the diagnosis. So that is the best strategy. So that's what I always follow. First line, last line, go to the choices, then go back to the question. You in most cases you will be able to know the answer even before you have read the question. So if you know the first line, last line, and the choices, you can 80% of the time predict what the answer is going to be. And then in the question, you are just searching for hints. And a lot of time, the question will give you unnecessary details just to distract you. Like he went for a beach vacation with his family about 6 months back. On returning, he noticed, this and that. So they'll make a whole story. Forget the story. Just pick up the things that are important and are going to lead you to the answer.
Also, ma'am, there are multiple times students have to take an exam. One of our authors did mention that get choosing a specialty is a lifelong commitment, and so you should not be in a rush. What do you think, and do you want to give a student some of that advice?
Definitely. Choosing a specialty is no rush. See what your interest is, whether you are a person who likes doing medicine or do you like doing surgery. So that is the broad criteria. Do you want to pick up a medical field or a surgical field? And if you think you're a surgeon at heart and you're not scared of blood and you love operating, then you can choose between all the surgical specialties that are available. And if you like a cool life, not too much stress, maybe go for other ancillary branches like microbiology, pathology, biochemistry, anatomy. They are great. I think they give you a very relaxed life and there are no emergency calls. But if you like thrill in life and you like to be on the forefront and you like to interact with patients one on one, then medical or surgical field is, I think, the best.
Right.
Really
So,
depends.
so everyone, that was what we had from Dr. Shruti and her insights on the subject. I hope you found that useful. If you have any further questions, you can put them in the chat. We can speak with, we can get them answered for you later. Meanwhile, we we are also running a small, there's a discount coupon also running with AIBH where you get a book online. If you buy an online book from Elsevier through AIBH, you get additional some 4% discount. So do check out that update as well from the page. And our next session is going to be on 28th of May, which is on preventive medicine, preventive social medicine, on community medicine with Dr. Rajveer Bharbar, who will be speaking about public health issue, will be answering your biostatistics questions, and how do you analyze public health scenarios and in terms of data. So do look out for that update and stay tuned in for our next session. And that was all, ma'am. Thank you so much for your time. And our apologies for we were not able to do this session today due to some technical issues. And thank you so much for all the people who have joined in today. And hope you got what you wanted from this session. Thank you so much.
Thank you for having me, and I wish all the best to all the students in their journey.